Here we'd like to demonstrate the use of one of the more popular treatments for facial ageing, that's a botulinum toxin. This treatment is very good for ageing that is associated in the upper half of the face, which is a result of hyperdynamic activity of the muscles of facial expression. So I'll get Mitra here to demonstrate for us. If you could frown, please. When you see her frown, it draws the brows together, and the muscles responsible for this, called the corrugators, deliver the classic grooving that you see between the brows. Raise your brows for me. And this is frontalis, that elevates the brows and is responsible for the horizontal frown lines that people see with ageing. And when one squints, you'll see the classic crow's feet occur at the corners of the eye. This will be a top-up treatment for Mitra today. We're simply going to do a little bit of work here on her corrugators and a little bit on her frontalis. We'll demonstrate this for you now. So if I could get Mitra to frown for us, you'll see the characteristic knitting together of the brows, which results in the vertical creases, and the muscles responsible for this are the corrugator muscles. If I can get Mitra to elevate her eyebrows for us, this is frontalis, and this causes the characteristic horizontal frown lines that one associates with ageing. Now this will be a top-up treatment, and we're going to put a little bit of botulinum toxin into the corrugator and into frontalis to complete her treatment and render her brow fairly static. So we prepare the area that we're going to treat with an alcohol wipe, clean the skin nicely there. We've not applied any local anaesthetic, none is usually required. These needles are extremely fine, and so we'll treat here first. Is that okay? Mm-hmm. It's very easily tolerated. There we go. And that's the first area treated. Is that okay?
Yeah.
And now the forehead. Brows up for me. Okay, relax. There we go. How's that?
That was fine.
Now that was a top-up treatment we've demonstrated. Normally the first treatment one would make a few more injections, but that's all that's needed for today. Okay?
Lovely.
Well done.
Thank you.